Hi there, everyone. Thank you so much for joining us on this beautiful morning, afternoon, or evening, whichever time you're listening. My name is Ashante Brown, and I am the project coordinator for South-Dade-Onevoice Community Coalition. And today we are being joined by a very special guest, Thomas Guerrera. How are you doing today?
I'm doing great. Thank you for having me. It's a pleasure to be here.
Yes, thank you so much for joining us. So if you don't know, Thomas is from the Miami Recovery Project, which is a fairly new organization down here in Miami. Can you give us a brief synopsis of what exactly Miami Recovery Project is?
Sure. So Miami Recovery Project, we are a little over, maybe almost 2 years old. We started last year during the pandemic. We're a nonprofit organization that supports folks that are in recovery or looking for help in recovery. We are not a recovery community organization. What that means is that we provide recovery services, recovery support services, and provide a number of different pathways to recovery for people that are trying to get into recovery.
And I probably should have started with this, but can you introduce yourself so people know exactly who you are
Yeah,
and the
sure.
role you play?
Yeah, so I'm Thomas Guerra, or you can call me Tommy. I am the executive director here at Miami Recovery Project. I'm also a person in long-term recovery. For me, that means I haven't had a drink or a drug since September 12th of 2014. And that's allowed me to progress in my life, allowed me to be a son again to my parents, to be a father to my kids, and to go back to school and get my education, which it was pretty much impossible for me to do while I was in my active addiction.
And that's good to hear. And I'm glad that you were able to accomplish such wonderful things ever since. Do you mind if I ask, is it difficult being in long-term recovery?
I would say these days it's not as difficult as it was in the beginning, simply because I have a purpose now, and that kind of helps me stay on track. And the urges and the cravings, they no longer happen. So when I was in early recovery, it was kind of everything was a trigger. Drinking, using, you see everything, and stress. That was very difficult. But as time went on, and I'll tell you what, this is not the first time that I've attempted to be in recovery. Hopefully it's the last, but I've had many bumps in the road along the way which I learned from. And that's what I tell a lot of the people I work with is, what can we learn from, the past? What can we learn from the things, that didn't work? Because I know a lot what doesn't work.
That's cool. That's great to hear. And so can you kind of give us a background on exactly how the organization came to be? You said you're the executive director of it.
Yes.
Can you tell us how it was founded and the purpose?
Sure. So I'm the executive director. I'm also the founder. We started last year during the pandemic. The idea for Miami Recovery Project, though, started in about 2019. I attended a conference in Las Vegas. It was called Mobilize Recovery. And basically it was a conference to unite people in the recovery community and to educate and to help people advocate for their communities. What I learned was that there were an organization called RCOs, which are recovery community organizations all around the United States, that are helping people directly in their communities. And when I saw what was being done all around the United States, and then I looked back at Miami and saw that there's no RCOs at all at that time, it kind of was very confusing to me, because we're in Miami. We're one of the biggest communities, and there's drugs and alcohol is prevalent, yet there's no RCOs available. So that's where the idea came about. And then when the pandemic hit, it was just like, all right, I have opportunity now. I'm stuck at home. Let's make something happen. And I started filling out all the paperwork and all the things we needed to do to become a nonprofit. And luckily, we've been blessed, and we were able to get a grant this year, and everything's been going pretty fast. We got a grant in April from Thriving Mind and DCF, so it's kind of allowed us to get our foot in the door of providing services. And before it was kind of like we had no working capital, no money whatsoever to do anything, and it was kind of a side gig to my full-time job. And now this has become my job, and I left my previous job. So it's been a blessing.
That's amazing. And for those who don't know, well, of course, everybody knows about when COVID-19 hit, but in terms of addiction and overdose, that hit a major rise all across the United States, all across the nation, and a lot in Miami. Our rates went up. Wow, it was really large. And so it's great that you were able to come in kind of when that all started and was able to get some work on the ground. And so you mentioned, of course, about the recovery community, but what are some of the other services that you are able to provide, kind of like before you were able to get the funding, but since the funding, how were you able to expand?
Okay. So prior to the funding, we did a lot of stuff that didn't require too much money. Was meetings, doing recovery meetings. We did an all recovery meeting through Zoom, which was easy to run, and we had a lot of guest speakers come share. We had some special events, some trainings, some presentations, which didn't take too much money to do. And so since we got the grant, we were able to get a space here in Coral Gables where we now have an office where people could come in and have an actual meeting in person, and also meet with our peer specialist that we have on staff. We also do overdose prevention training. We do a lot of that. And so we do that either here in the office through Zoom, or we go out into the community and do the trainings and distribute Narcan. And so Narcan is a overdose prevention medication that if someone is going through an overdose, they that are administered Narcan, and they will have an opportunity at surviving, a highly likely of surviving from that overdose. And so that's, you talked about overdose and the rates increasing. We're at a record amount of overdose in the United States. And not only is it a record, it destroyed the last number by almost 20,000 people.
Oh, wow.
And that's a direct result of COVID and people isolating and people, not doing the things they were doing before. So we want to kind of tap into that and try to lower that again, because that number is crazy. It's too many people we're losing.
Yeah, one person is just too many all the way around.
Right.
And the population that you serve, is it just adults or is it just anybody?
Right. Primarily, we work with adults. Through our grant is for adults and people with opioid use disorder and stimulant use disorder. But I'll tell you what, a lot of the services are available to anybody. Like the meetings that we hold, there's no restriction on that. People can come for help too. We have, I believe, 3 different meetings that we host here at the office. We have a recovery dharma, which is a Buddhist approach to recovery, and it's we like to provide alternatives, a lot of different alternatives and options instead of just one way. So we have recovery dharma. We have an all recovery meeting, and next week we're starting smart recovery, which is more of a cognitive approach to recovery as opposed to working steps or having a spiritual aspect to it. And there's not one way better than the other. It's just having options, and we like to provide a lot of options, because everybody's different.
Right. And are there set times for these meetings that you have?
Yeah, sure. So the Tuesday at 7:00 is the Recovery Dharma meeting, and we have it here in our office and also on Zoom. And Thursday we have all recovery meeting at 6:00, which is again in our office and on Zoom. And then start next week, we'll have a smart recovery meeting on Wednesdays at 6:30, also available on Zoom and in person. So that's kind of the new norm, is to have a hybrid meeting.
That's actually very smart because you're able to reach more people that way, and more people are able to get help. And so you mentioned doing the Narcan trainings, which I recommend for anybody to do. I actually sat through it. I got a random email and I sat through it, and I was just like, wow, because it's actually really informative. So they inform you about what opioids are, give you the signs, what to do. If you have questions, feel free to ask questions. They'll answer it. They'll be anonymous if you want them to be anonymous. Um, and so I recommend that, but also partnering with other people. I know about Panthers for Recovery. So, because we follow them on social media, we'll repost some of the meetings they do. Can you talk a little bit about that? I'm not exactly sure if they're connected all the way, but I know.
Well, the connection is that I'm the founder of Panthers for Recovery too at FIU, and that came about when I was a student there. I graduated from FIU in 2018. And we founded Panthers for Recovery in 2016, I believe it was. I could be wrong on the date, but what happened was that during my schooling at FIU, I had been in recovery for a little while, and I had a reoccurrence of use, and I started drinking and using again, because I didn't have my recovery as a priority anymore. It was more school and my kids and everything I put in front of my recovery that recovery gave me was more important. And it should be the opposite: recovery first and then everything else. But what happened was that I started drinking and using again, and not only did I start drinking and using, but my first drink in over 3 years was on campus at the restaurant they have at the Chili's there. And it's not Chili's fault or the FIU's fault, but it was very easily accessible there. So when I was looking for help and trying to get, I put some weeks together and I was sober and I was looking for some recovery support. I reached out to the office there and they didn't have anything, which was, it was not a good thing for me. It kind of put me in a bad place. And then within a few weeks, I was back at it and drinking and using again. But luckily I was able to get into recovery again through some help through, some community friends that I had before. But that's kind of always stayed in the back of my head when I returned to school. And so that's how Panthers for Recovery came about. And it's a student organization where we were able to have meetings, 12-step meetings and all recovery meetings, but also events open to the public. And we had sober tailgates, which is for the FIU football games and the baseball games. It's kind of like you don't think tailgating, you think sober, but we had opportunity to hang out with other students that are doing the same thing, because it's kind of it's hard being sober on a college campus where it appears that everybody is drinking and using.
Right.
And so that was how Panthers for Recovery came about. And they're still having meetings, and we still have a presence on campus. I'm kind of not as involved, but I kind of oversee it a little bit. But I guess you would call that the sister organization of Miami Recovery Project.
That's cool though, and it's great that even though you weren't initially, there was nothing there, something was able to come out of it. And it really does help people, because people don't understand when it comes to college, oftentimes that's where a lot of addictions tend to start, because that's where you're introduced to a lot of things. And so if you don't have resources there to kind of help you out,
absolutely. I mean, I was just there on Saturday. They had a freshman orientation. And this is the first time a lot of kids are away from their parents for the first time they have freedom for the first time, and nobody knows how they're going to react to substances and alcohol. Some people are able to take it or leave it, but some people, like myself, it's not as easy, and it becomes a full out alcohol use disorder or substance use disorder. So it's just about providing the means for help for those that fall into that category. And I'll tell you what, that was some of my best college experiences is after Panthers for Recovery was formed, because I started connecting with other students that were just like me. And those students were, amazing. Like before, I had I had no real college experience. I would just go to class and leave, never connect with anybody. But after Panthers for Recovery, all my friends I still have to this day from Panthers for Recovery, and they're doing pretty big things, PhDs, and my friend just graduated from law school, and these are things that we didn't even think were possible when we were in our active addiction. I have a friend of mine that just got into law school. She was homeless at 16, and she just got into a full scholarship into law school. And this is the beauty of recovery, and that's kind of why I got into this field.
Well, that's really amazing. And I'm glad to hear it. And it seems like you have been doing a lot, and it is good to hear it. And something interesting is that when it comes to it, so understandable that, Panthers for Recovery and the Miami Recovery Project is all about recovery, but it's great that you also do kind of prevention initiatives. So, a lot of people don't understand the whole process when it comes to, I guess you would call it the continuum of care, is that you have the prevention. And so you're trying to educate, also reducing stigma, just trying to make people, eyes open to what's going on. And some people are able to take the message and some aren't. And so then you end up with some who unfortunately, go through the addiction process and then go through recovery. But it's great when you have those who go through that recovery, but are able to turn that around and try and do more prevention, try and stop somebody in the beginning. And some things that people may not know is not even just the prevention for that individual, but it's for their family too, because
Absolutely.
It's educating them to help their own family. So
100%. And so, I mean, speaking from experience, when I got into my I started getting into more drinking and using, my parents had no idea what to do. They had no idea. They were first in denial, then they had no idea what to do with me. And that's how a lot of parents are in. They it's something they don't talk about. Maybe they had something in their family before, but they don't talk about it, so it's not known in the family history. So it's really a result of the stigma that comes with addiction. And so that's kind of why we, here at Miami Recovery Project, Panthers for Recovery, we share a lot of our stories and share what's happened with us as a result of, just trying to get people to talk about it. And also with prevention, prevention is easier than treatment. Helping people not start is way better, way better than later on intervening. But people are going to fall through that. So, I love speaking to young people and sharing my story and educating them, and just, giving them a fighting chance, before, because to tell you the truth, I wasn't really, it wasn't brought to me when I was a younger person. There was, of course, the DARE program, but it was more kind of a punitive approach, right? You get punished because of this, and this, as opposed to, hey, look, this is what addiction looks like, and it could happen to anybody, even people you love, and there's no, there's no criminal aspect to it. It's more of a human aspect.
Yeah.
So yeah.
So I have a question. When it comes to it, is there only a specific substance that you all focus on when you host the meetings, or is it just open to any form of recovery?
Yeah, the meetings we host here are open to any type of addiction, even process addictions, but primarily a lot of the folks come for substance use or alcohol use, but there's addiction to the technology, there's addiction to gambling, sex, anything. It's really doing the same thing. It's helping somebody escape through something else. And so there's a lot of similarities. And so the recovery dharma, people could come for anything. All recovery, people could come for anything. And then also smart recovery as well. And so, primarily we get people with the substance use disorder, alcohol use disorder, but I'll tell you what, most people have co-occurring issues, right? So you can get support for that as well, whether it's a mental health or another some other type of addiction.
And all these services, they're free or low cost?
Free of charge. The meetings are free for sure. Actually, everything's free when it comes to the meetings. To qualify for a peer support, it is free if you have an opioid use disorder or a substance use disorder, simply because that's the way our grant is set up. It's a state opioid response grant, which focuses on that. Unfortunately, I wish it was for everything, because it's an addiction crisis, not an opioid crisis. It's everything, and it's that's a whole different story I could get into on when it comes to people of color and all, and how it's health disparities and but we take what we can get for now as a foot in the door, but we really want to serve all our community, and whatever Miami looks like, we want to serve that.
And so besides the meetings that you all host, are there any other activities that you all have going on?
Yes, like I said, we have the Narcan training, but also we actually have an event coming up, which is pretty exciting, which is the Overdose Awareness Day. And it's going to be held at FIU. Since I have some ties to FIU, I was able to host it there on August 31st from 6 to 8:30. And we're going to have resource tables from treatment centers to detoxes to nonprofit organizations to organizations that help with homeless outreach and on-campus organizations. And it's just really a way to help people find support, help find the resources that they need when they're in a situation and they don't know what to do. And the majority of these organizations are nonprofit organizations, so they're not going to be charging money or too much money. It'll be easily accessible to the everybody.
And that's great.
Yeah, and also I forgot, we're going to have some guest speakers, so that's going to be pretty cool too. We have the Idea Exchange, which is a syringe exchange program and Narcan distribution program that started I believe like in 2015 or maybe before, but they were the first of its kind in Florida, and it was a pilot program, and now it's a bill has passed where they can expand that throughout Florida, and they're the ones that started it. So we have one of the founders, his name's Eddie Suarez. He's going to come and share about that, and then we have another speaker. His name is Fred DeMarco, he's the author and poet. He lost his son to a accidental overdose, and he'll be sharing his experience on that. We have a proclamation that was signed by the mayor of Miami-Dade County. I'm not sure if she's going to show up. I don't think so. Maybe, I don't know, but we'll have representation there, and we're going to present that. And then finally, we're going to have a candlelight vigil, just as a way to show support and remembrance of the people we've lost to overdose.
That's great. And for those who may not know, every year annually on August 31st, it is International Overdose Awareness Day. And basically the focus for that is about reducing the number of deaths related to overdose. It's about erasing the stigma associated with overdose and addiction, as well as educating the public to empower them with the knowledge to kind of prevent overdose from happening. So some people when they think about overdose, they mainly particularly think about street drugs or illegal drugs, but it's also prescription medications or over-the-counter medication. If you take more than you're supposed to, if you're taking somebody else, if you're mixing it with different substances, all of these things can lead to overdoses. And so it's just about mainly just awareness, education, and just trying to reduce the amount of deaths and, get people back on track to before it even started.
Yeah, you're 100% correct. And you're right that the stigma tells us that, it's not going to affect us, but in reality, it affects anybody. You talked about prescription drugs and, and even drugs that are not even supposed to have opioids in it are being cut with fentanyl, and people not intentionally taking opioids are dying.
Right.
And it's unfortunate, but it's just about getting that conversation out there and letting people know, hey, no, it's not just people who are injecting. It's anybody. I mean, it's people that are even taking prescriptions as prescribed. Unfortunately, it can happen. And when you get a prescription, there's a warning on there that says, hey, you may be in danger of overdose. You may want to take some Narcan with you. And so a lot of people don't know that. And it's just about educating and sharing stories. And, that's where it starts.
And so that's why we do urge, anybody who takes an opioid, I strongly urge that you go through the training that they have, obtain some Narcan, because even if it's not you, if you see somebody on the street, you can help them. We have the Good Samaritan law here in Florida that if you take that initiative to help somebody you think is, overdosing, there's no damage done to you because you're trying to help save a life. So, and that's another thing they do talk about during the training. I remember that training. I liked it so much.
I think you were paying attention there in the training. Yeah, that's absolutely correct. And the Narcan is available without a prescription, or it basically is called a third-party prescription. So that means that if you're around anybody that is at risk of an overdose, and you can get over the counter or get it from a pharmacist, and that's pretty much anybody. If you go out and walk around in the public, then you are maybe at risk of seeing somebody overdose. And so, I mean, we do trainings with pretty much anybody that's willing to take the training, and you can set it up with us, and we could go to your organization and provide the Narcan there. And just a preventive measure to have it on you. And it's better to have it on you and not need it, but than to, not have it and need it. Pretty much I have it everywhere I go. I give it to anybody I can. And, it's very simple to use. And you talk about Good Samaritan laws. That also, for anybody that is using, it prevents you from getting prosecuted, right? So if you're trying to save somebody's life, a lot of people would avoid calling 911 because they didn't want to get caught with possession. The Good Samaritan law allows you not to be prosecuted for small possession or paraphernalia. So if that's what's preventing you from calling for help, please call for help. It's really about saving a life.
So do the training. I encourage everybody to attend the event that they have going on. Once again, you said it's at FIU. What time does it start?
It's at 6 p.m. on August 31st. It's going to be in the Graham Center. And so, people can park in meters. It's best to enter through the 107th Avenue entrance. It's 107th Avenue and 16th Street. And then you can park in the Gold Garage or any of the meters there, and it's in the Graham Center. So please come out, show support. We're going to have some great speakers, great resources, and just, remember those that we lost, and then also help others that are still struggling.
Yes, so I encourage all of you to go out there, get the information, bring a friend, bring a family member, get everybody educated.
Yes.
Because you may never know, is maybe somebody in your family, maybe a friend, maybe a college student, and it's just an opportunity to kind of help everybody out. Is there any additional comments? It was really great having you on here.
Thank you. No, I would just say, man, recovery is available to everyone, and it's just about reaching out for help, and we're here, but there's other organizations available as well. You can find us on the web, MiamiRecoveryProject.org. Our office number is 305-967-8509, making sure it's the right number. And then also, just look at the social media. We always post all our events. We're always posting, the meetings, reminders for the meetings, and we got good content on the social medias. Follow us on Instagram, Miami Recovery Project, and Facebook is also Miami Recovery Project. And then what's the other one? Twitter is Miami R Project. I think I got all of them there.
So I'll be sure to put all of his social medias and the website. I'll put it on the screen, but we'll also put it in the description bar, just the hyperlink, so it's easy for you to access it. But I thank you so much for coming on here and talking. And, I really hope great success comes out of everything that you're doing, because you are doing a lot and it is helping a lot of people. And, Miami at this point in time, from South Miami to North Miami, we need the help. We need the help.
Absolutely.
And
I
so,
appreciate it. I appreciate it. And I know this is just the beginning. We want to expand to all over, to Florida City, to, Overtown, to everywhere. So we can tap into all the community. So I
yeah.
appreciate you having me here.
No, thank you. And like he said, guys, this is very fresh, but he's doing a lot. The company, they are doing a lot. And so, we really encourage you, if you need the meetings, join the meetings. If you don't need it, pass it on to a friend. And we'll make sure we put all the information so you're able to access the meetings as well, either with both the location or how to obtain the Zoom information. We'll make sure we have that on the screen and in the description box as well.
Awesome.
So I want to thank you so much for joining us, Thomas. Everybody check out Miami Recovery Project. We'll put their website down below as well. But thank you so much. And once again, I am Ashante Brown from South-Dade-One-Voice Community Coalition. And we hope you all got a lot from this podcast. Thank you all so much for joining us.